Hip arthroscopy has experienced an exponential growth over the past 2 decades. Most of the procedures are currently performed intra-articular. However, as the field evolves, the arthroscopic techniques are now being translated to extra-articular pathology of the proximal femur. This video illustrates the anatomy of the structures that are normally treated by hip arthroscopy, including both intra- and extra-articular hip pathology. The treatment of peritrochanteric area involves the reattachment of gluteus medius and minimus tendon, pulsar resection, treatment of piriformis and deep gluteal syndromes as a result of a sciatic nerve entrapment by the piriformis, gemmelli, and the obturator internus muscle. Two major bony structures are identified in the posterior hip, the greater tuberosity and the ischium. The gluteus medius footprint insertion is located in the lateral aspect of the greater trochanter. The piriformis inserts as a triangle in a small fossa located medial and inferior to the superior medial border of the greater trochanter. The superior gemellus, obturator internus, and inferior gemellus muscle forms the conjoint tendon which inserts on the middle surface of the greater trochanter. The quadratus femoris is a rectangular shaped muscle that inserts more distal at the inferior margin of the intertrochanteric crest. The proximal hamstring insertion is composed of the biceps and the semitendinous medial and semimembranous at the lateral aspect of the ischium. They all insert as a conjoint tendon proximally and separate 5 to 10 centimeters distal to the ischium. Here you can see the footprint insertion of the piriformis muscle in a triangle shape at the middle aspect of the greater trochanter. The superior gemellus, the obturator internus, and the inferior gemellus form the conjoint tendon insertion at the middle aspect of the greater trochanter. The obturator externus runs immediately anterior to the quadratus femoris and inserts at the posterior area of the greater trochanter. The hip is a ball and socket joint that is comprised by the articulation of the proximal femur and the acetabulum. You can see here part of the iliofemoralis ligament, which is normally incised when a T-capsulotomy is performed for cam resection. Note also the sealing effect that the labrum provides to the hip. The ligamentum teres is attached to the ischial and pubic sides of the acetabular notch and inserts distally into the fovea of the femoral head. The teres plays a role in being a hip stabilizer, especially with hip rotations. The pulvinar is another intra-articular structure composed of fat tissue that normally fills the floor of the fovea. The labrum follows the outside rim of the socket and is composed of fibrocartilage tissue. Most of LaPrade tears are located between 12 and 2 o'clock, corresponding to the anterior superior area where the cam lesion normally impinges.